Pleasant day, everyone. This is Rachel Garcia, and our topic for this time is epidemiological models and the Philippine health situation. Epidemiology sparks a lot of curiosity. People have plenty of questions like what is epidemiological study and what are the uses of epidemiology. Basically, imagine that a patient who is sick and you are trying to figure out why he gets sick. Now imagine that your patient is actually an entire group of people. The objective of epidemiology is to figure out what causes different health outcomes in different groups of people. And this group of people can be as small as your neighborhood or as large as the global population. Now, epidemiological models helps us describe the cause or trace the cause of a particular disease. Now, one particular model that we can use to describe this certain phenomenon is the epidemiological triad or triangle. This is the traditional model for infectious disease. The triad consists of an external environment, so your environment, and your agent, and your susceptible host. An environment, okay, that brings the host and agent together. In this model, disease results from interaction between agent and susceptible host in an environment that supports the agent from a source to that of the host. Agent, host, and environment factors are interrelated in variety of complex ways to produce disease. Different diseases require different balances and interaction of these three components. Development of appropriate, practical, and effective public health measures to control or prevent disease usually requires assessment of these three components and their interaction. So basically, we have to figure out that this has to be balanced. Agent and host is basically balanced by the environment. When the environment favors the growth of the agent, the host will be affected. So let us see how these things are going on. So this is an example of a particular imbalance in the triangle or in the model. When the agent becomes more pathogenic, the environment basically favors the growth of the agent. And when the environment changes and favors the agent, okay, this basically helps the environment, the host, to become more, okay, favorable for survival. On the other hand, the disproportion of susceptible in the population basically decreases, and environment changes favors the host. So if the environment favors the host, disease will not set in. Okay, and this will provide us with a steady equilibrium state. Okay, so disease usually set in when the agent becomes more pathogenic and the environment favors the growth of the agent. And another model is the will model. This model represents the host, or the human, as the focus who has the genetic makeup as its core. And it is surrounded by four environmental elements. The relative size of the will components vary from one disease to the other. In contrast to the previous model, or the triad model, the will model distinguishes the host from the environment, thus more useful for epidemiological analysis. So you have your human host, your environment, your biological, social, physical environment that affects the human host and influence the possibility of acquiring the disease. Another model that can explain why a particular disease occurs is the web causation, which explores on multiple causation factors. So, giving each an equal prominence in identifying determinants and relative intervention, the model implies that the disease is developed as a result of chain of causation. This model implies that cutting the chain at different points would interrupt disease development even without complete understanding of the causal mechanism. So, in this particular condition, there are many variables to consider, and you could hardly pinpoint that one directly influenced the other. So that is web model. So this can also be like factors of microbes, factor of social organization, behavior, environment, workplace, or any other unknown factors. So like autoimmune diseases, we could hardly recognize what caused what brought about the disease, but there are many risk factors to consider that may be contributing to the development of the disease. And web model is one good way to explain how things happen or how the disease occur. Now, there are 6 epidemiological levels of disease that we can explore on. First is sporadic. Sporadic refers to disease that occurs infrequently or irregularly, or you can say sparingly occurring in a particular locality. Next is endemic. Endemic is constant presence of a particular disease in a particular population in a particular geographic area. Hyperendemic is the presence of refers to persistence, high level of disease occurrence in a particular locality. Epidemic refers to increase or often sudden in the number of cases of a particular disease above what is normally expected in that particular population in a particular area. Outbreak carries the same definition of epidemic, but it is often used for a more limited geographic area. Factors that triggers epidemic would include increase in amount of virulence, recent introduction of the agent into a setting where it is not usually present before, an enhanced mode of transmission so that more susceptible persons are exposed, a change in susceptibility of the host response to a particular agent. Okay? Factors that increase host exposure or involve introduction throughout new portals of entry. Next is cluster. Cluster refers to aggregation of cases grouped in a place and time that are suspected to be greater than the number expected, even though the expected number may not be known. And lastly is the pandemic, which refers to the epidemic that has spread over several countries or continents, usually affecting a large number of people. So, as we may see, COVID-19 is affecting not only the Asian continent, but American and the global continent at large. So, that is considered a pandemic. Now, for us to vividly picture the Philippine health situation, we can use the morbidity and mortality statistics of the Philippines. What is available in the DOH portal right now is the 2017 leading causes of morbidity. Okay, so this is out of 1,000. So you have 2,382.12, okay, per 1,000 acute respiratory infections. So next in line is hypertension. We also have on the third rank is acute lower respiratory tract infection and pneumonia, urinary tract infection. We also have bronchitis, influenza, acute watery diarrhea, asthma all forms, TB, respiratory, and acute febrile illnesses. Let us try to explore on the types of diseases that affects the Filipino people in 2017. So let us identify it one by one. Acute respiratory infection is an infectious disease, right? Uh, Hypertension is lifestyle disease. Acute lower respiratory tract infection and pneumonia is an infectious disease. UTI is an infectious disease. Bronchitis is usually an infectious disease. Influenza is an infectious disease. Acute watery diarrheal disease is an infectious disease. Asthma, all forms, may or may not be infectious disease, but most of the time it is categorized as infectious disease. We also have, or triggered by infectious disease, we also have TB respiratory as your infectious disease and acute febrile illness as infectious disease. So if we will try to look at the statistics of the morbidity, top 10 leading morbidity in the Philippines, it is generally affected by infectious diseases. So around 80 to 90% of the diseases in the top 10 belongs to the infectious diseases. So this can be concluded that infectious diseases largely or easily spreads, okay, and in human host. Now let us try at uh, so this is the same top 10 cause of death. Okay, so let us try to look at the top 10 leading cause of death in the Philippines. So we have number 1 in the list, the ischemic heart disease. Second is neoplasm. Third is cardiovascular disease. Fourth is pneumonia. Fifth is diabetes. And then sixth is hypertensive disease. And then chronic lower respiratory disease, respiratory tuberculosis, and other heart diseases. And then remainder of diseases of the genitourinary system. So if we will like to categorize these diseases that causes death in the Philippines, we have ischemic heart disease as lifestyle or non-infectious, neoplasm, non-infectious, cardiovascular disease, non-infectious, pneumonia infectious. So we already have one. And then diabetes mellitus, generally non-infectious. If you have type 2, so it's more of a lifestyle. But if you have type 1, this is an immune disease. And then hypertensive is non-infectious. Then chronic respiratory infection, so that's infectious. Respiratory tuberculosis, that's infectious. And other heart diseases, that is non-infectious. And then remainder of diseases of the genitourinary system. So if that is referring to kidney failure, so not all kidney failure is brought about by infection, but it may be. No, there are some that may be categorized under infectious diseases like acute glomerulonephritis in source, but not, as mentioned earlier, not all of the kidney diseases are coming or rooted from the infectious disease. Now, if we will try to count, only 30% produces cause of death, okay, from the infectious side. So meaning to say, infectious diseases can easily be spread, but it can also be controlled. It can be prevented. It can be treated, okay, and prevent death by using antimicrobials and other forms of treatment. So infectious disease is morbid but not deadly by nature, and can be prevented as if we will break the chain of infection. So if you will try to look at, I think I highlighted only 2 possible, or 20 to 30%, that produces. Over the years, if you will try to look at the cause of death from 2013 to 2017, this information remains the same. So pneumonia and other respiratory tuberculosis disease remains in the top 10 leading causes of mortality. And this can give us a reflection that what the government is doing in terms of prevention of these diseases. Basically, pneumonia can be prevented by vaccines. Tuberculosis can be prevented by vaccine. But how come these things are still in place from 2013 to 2017? And I believe after this point in time, this particular diseases remains in the top 10 leading causes of death in the Philippines. So when time comes, we could actually look at this possibility to explore on how we can prevent or take out these 2 or 3 factors or infectious diseases in the top 10 leading causes of mortality in the country. Let us try to explore the possibility of looking or reviewing the programs instituted by the government and how well we can really prevent diseases from spreading. So that is the topic. Now I want you to look at the statistics of COVID-19 cases in the Philippines, as this data is from March up to August 7. And it's up for you to describe the graph and the epidemiological presentation or pattern of the COVID-19 disease in the country. And are we really preventing, are we really flattening the curve? And what are we doing to contribute to the flattening of the curve? And how can we contribute even more to the flattening of the curve of COVID-19? So those questions were thrown to you to reflect upon and try to look back how things went on with your self, with your family, and with your community, and how well can we contribute to the flattening of the curve of COVID-19 statistics. Next is I want you to reflect on the roles of epidemiology in public health. So how will these figures influence our behavior as a Filipino citizen in responding to the diseases that affects the country? Now, again, I would like you to pause for a while, think back, and reflect upon your personal contribution on the public health of the country. And that ends our discussion. Again, this is Rachel Garcia. See you on my next topic.